Here's a powerful drink that research shows can cut the relative risk of heart attack and stroke by more than 50%. It's one of the simplest health tips you'll ever hear, yet it's often overlooked. I've always wondered why garlic isn't widely used as a primary medication for heart conditions. And the truth is, I know the reason. There's simply no profit in it. That's why today I want to share with you something simple, inexpensive, and natural: garlic water. This easy remedy can be part of your arsenal of healthy food recipes to support your heart and overall wellness. Especially for older adults, it's a fantastic addition to any routine, one of those senior health tips that can truly make a difference. Of course, while garlic water is a wonderful example of healthy food supporting better health, nothing in this video is intended to diagnose or replace your professional care. Always consult your physician before making any changes, and remember that in a real emergency medicine situation, immediate medical attention is crucial. Numerous studies have shown that garlic is effective in lowering blood pressure, but that's just the tip of the iceberg of what garlic can do for your heart. Before we get into that, I want to tell you about some of garlic's other incredible benefits. First, garlic has antiviral properties. Since most common colds are caused by viruses, you should consider eating garlic at the first sign of symptoms. This is important because every time your body fights an infection, it increases inflammation throughout your body, a known risk factor for cardiovascular disease. Second, garlic has antifungal capabilities. For example, if you have a candida infection, which often shows up as a white coating on your tongue, garlic is a natural solution. This condition is common after taking antibiotics because they wipe out the friendly bacteria that help keep fungus in check. When that control is gone, fungus can overgrow. Like a viral infection, this fungal overgrowth contributes to chronic inflammation, which is bad for your blood vessels. Garlic is also a potent antibacterial agent. It acts as a natural antibiotic, effective against both tuberculosis, TB, and H. pylori, the bacteria that not only causes stomach ulcers, but is also linked to inflammation of the arteries. Garlic is also an effective antiparasitic, helping to eliminate worms and other parasites. The overall goal of all of this is to reduce the burden on your immune system, which in turn lowers inflammation throughout your body. And here is the most crucial point. Garlic's power to address the root of many problems by improving insulin resistance. Chronically high insulin not only causes issues like a fatty liver, but it also creates inflammation and hardening of your artery walls, setting the stage for blood clots to form, the direct cause of a stroke. By helping to lower insulin and improve insulin resistance, garlic helps control blood sugar and protect your blood vessels. If you've been watching my videos for a while, you know all the consequences of excess insulin. There have been numerous studies, including cancer research in Europe, that have demonstrated garlic's strong anti-cancer effects. Not only that, but garlic can also help treat arthritis and any condition ending in itis, as this is a medical term for inflammation, and garlic is a powerful anti-inflammatory. So, it's useful for anything like bursitis, tendinitis, or arthritis. Garlic may also help increase endurance if you're an athlete. But today, I want to focus primarily on heart health. Over 40 clinical trials have shown significant benefits of using garlic for the cardiovascular system. In fact, one of them, which I'll link below, revealed that the relative risk of heart attacks and strokes could be reduced by more than 50%. With such a tremendous benefit, the question is, why isn't everyone adding garlic to their diet regularly? To understand this better, let's look at how it works. There's a compound in the body called thromboxane. I won't get too deep into the chemistry, but essentially its job is to make platelets in your blood stick together, forming a clot. This clot can then get lodged in the blood vessels of your heart, causing a heart attack, or it can travel up to the arteries in your brain, potentially causing a stroke. This compound also causes vasoconstriction, meaning it makes your arteries clamp down, especially the coronary arteries. And now, I'll explain this topic a bit further so you can understand what I'm talking about. First, Let's discuss the more menacing of the two, unstable angina. This condition is a true medical emergency. It's often associated with what's called a vasospastic event, where the coronary arteries that feed your heart muscle suddenly spasm and clamp down, severely restricting blood flow. The real peril, however, lies in the nature of the plaque buildup within the artery. In unstable angina, this plaque is soft, inflamed, and vulnerable, like a ticking time bomb. It has a high risk of rupturing spontaneously without any clear trigger. When this unstable plaque breaks open, it can form a clot that travels through the bloodstream, ultimately lodging in a smaller vessel in the heart, causing a heart attack, or in the brain, causing a stroke. This is why it is so profoundly dangerous. A defining characteristic of unstable angina is its unpredictability. The pain can strike out of the blue even when you are completely at rest, perhaps while reading a book or even waking you from sleep in the middle of the night. The discomfort might last for 10 minutes, subside, and then return. Any new, changing, or unexpected chest pain that occurs at rest should be treated as an urgent medical situation. In contrast, stable angina operates on a more predictable pattern. While it also involves plaque in the arteries, this plaque is typically older, harder, and protected by a thick, fibrous cap, almost like a callus. This makes it far less likely to rupture unexpectedly. Instead, the pain of stable angina is consistently triggered by physical exertion or emotional stress, times when the heart demands more oxygen-rich blood than the narrowed artery can deliver. You might feel it when you walk up a flight of stairs, carry heavy groceries, or work in the yard. Crucially, the pain typically subsides within a few minutes of stopping the activity and resting. While it's still a serious warning sign of underlying heart disease, it doesn't carry the same immediate, unpredictable threat of rupture as its unstable counterpart. Now, there are many risk factors for angina. Of course, we have smoking and nicotine use. Obesity is also a factor. Then there's diabetes, a condition where you have issues with insulin and your arteries become very, very stiff. High blood pressure is another risk factor. Stress can be a trigger. Insulin resistance will cause inflammation inside the arteries. When that happens, you see a domino effect. The body tries to heal it by creating a band-aid out of cholesterol, calcium, and protein, which forms the plaque. Alcohol is a cause. Marijuana and cocaine can also be triggers. And energy drinks. Some teenagers today drink a lot of energy drinks, combining large amounts of sugar with caffeine, and there have been quite a few cases of heart attacks in young people due to these beverages. All right, now let's get back to that compound, thromboxane, which is a very powerful vasoconstrictor. When levels of this compound in your body are too high, you get high blood pressure. This chemical usually shows up after an injury or when there's inflammation. As it turns out, some things can inhibit this compound. This is the principle behind how blood thinners work. Even aspirin works by inhibiting this compound. But did you know? Garlic contains several compounds that act as a natural inhibitor for thromboxane, but without the side effects. Olive oil has this ability as well. Garlic has natural properties that help lower blood pressure, reduce the stiffness of your arteries, likely because it helps lower insulin, and it can help bring down your calcium score. There's an excellent test, perhaps one of the most accurate predictors of heart attacks, called the calcium score test. Ideally, that score should be 0. If it's over 400 or 500 or even over 1,000, it can strongly predict your risk of a heart attack. So it's a very good test to get. But guess what? Garlic can help lower that calcium score. In studies where statin drugs were used to try and lower this score, they were unsuccessful, but garlic can help bring it down. Garlic can also help balance your lipid and cholesterol levels by helping your body produce more bile. Bile is the very tool your body uses to get rid of excess cholesterol. So, by increasing bile flow, garlic gives your body a more effective cholesterol cleanup mechanism. Now, remember that garlic is highly antibacterial. It works on viruses, fungi, and bacteria. Because of this, it can help with another serious heart-related issue, bacterial endocarditis. This is essentially an infection, sometimes caused by staph bacteria or fungus, that forms biofilms right inside your arteries. And you know what? Garlic can act as a natural antibiotic to fight this condition without the side effects. So, that's just one more benefit garlic can offer your cardiovascular system. So, let's recap the incredible benefits of garlic for your heart and overall health. It naturally thins the blood, lowering the risk of dangerous clots. It's antibacterial, helping fight infections that can stress the heart. It supports healthy cholesterol levels, moving excess cholesterol and fats out of your arteries by boosting bile production. It helps regulate blood pressure, keeping vessels open and reducing harmful constriction. It even softens arteries and reduces excess calcium buildup, protecting long-term cardiovascular function. Honestly, with benefits like these, I don't see why anyone wouldn't make garlic a regular part of their diet. Now, let's get to the good part. How to make this incredibly complicated drink. And yes, I'm being sarcastic. Garlic water recipe. Crush 1 fresh clove of garlic. Add it to 8 to 12 ounces of water. Stir in 1 teaspoon of extra virgin olive oil. Let it sit for about 15 minutes. That wait is crucial. It allows the garlic's powerful phytonutrients to fully release. The olive oil isn't just for flavor. It helps reduce harmful thromboxane compounds and ensures your body absorbs these fat-soluble nutrients. Of course, garlic water isn't your only option. You can cook with garlic, sprinkle it raw on your food, or even use high-quality supplements. Just remember, avoid garlic imported from places where it may be grown with chlorine-based chemicals or sewage fertilizer. The safest choice? Buy local garlic, or better yet, grow your own. And if you're serious about protecting your brain and heart, don't miss our other videos on the early warning signs of a stroke and the most effective ways to prevent one. Because when it comes to your health, a little knowledge and a clove of garlic can go a very long way.